Often people ask me, especially if they got like arthritis all over their lower back or their neck, like how is prolotherapy going to get rid of the arthritis? And they really don't understand the degenerative cascade. Recently I took my board exam in physical medicine and rehabilitation, and in the book was a step-by-step illustration as to the degenerative cascade. So it's not just me saying it, it's basically the Board of Physical Medicine and Rehabilitation saying it. And to get degenerative arthritis in the lower back, we also call this spondylosis. To get multi-level spondylosis or osteoarthritis in multiple segments of the vertebrae, whether it's the neck or the lower back, there's always going to be, and I should say almost always, there will be some ligament laxity as part of that cascade. So in other words, degenerative arthritis actually starts, most of the time it starts where a person gets like a whiplash injury, or they fall down, or they're in football and they're hit, and then their spine twists. So when that happens, they get ligament injury, they get vertebral ligament injury. So now they got instability in those joints. So I'm just going to illustrate it. This is a model of the neck. So this is a model of the neck. You know, and if the ligaments were here, you would see all kinds of ligaments between the vertebrae here. So this is the facet joint, and there's a capsule or ligaments that holds one facet joint to another facet joint. So when there's ligament injury, what happens is the vertebrae move too much. You know, they move too much. And chiropractors or osteopathic physicians call that subluxation. So once you get vertebral subluxations, that will increase the shear forces on the discs. So in other words, you can imagine there's a vertebral segment here, vertebral segment in here, then there's a disc in between. Well, all of a sudden, if this one's moving too much, you know, it's going to cause degeneration in the disc. So when someone has degenerative disc disease, even if it's herniated, the thing started with ligament laxity or ligament injury causing vertebral instability. So we just call that cervical instability or lumbar instability. So prolotherapy, by stimulating those ligaments to repair, it gets at the root cause of osteoarthritis or degenerative disc disease in the neck or the lower back. So once the vertebral segments start moving together and there's not excessive motion or there's no longer subluxations, then not only does the pinched nerve feelings go away, but just that dull stiffness or that dull ache, like after sitting, goes away. And then the person knows that, you know, the cause of the osteoarthritis has been resolved. And normally we would see folks about once a month, and it's normally 3 to 6 visits.